Hi, I'm Matt Moyster, an equine dental technician based in Buckinghamshire, United Kingdom. I've been doing this job now for 17 years, and this is a part of dentistry that I find both fascinating and frustrating at times. I've spent years questioning owners, riders of all abilities, specialist referral vets, and listening and working with other professionals within the equine industry. We're here today with professional event rider Andrew James at his home in Bedfordshire. Andrew has produced numerous horses up to 5-star level and is also sponsored by Spiller's Horse Feeds, who have kindly sponsored us to produce this video for you all today. There is evidence that dentistry has been performed on ridden horses since 1150 BC, with Mongolian horsemen seeking to improve the rideability of their ponies, although knowledge, equipment and training has come on somewhat since then. I certainly wish that every horse I treated turned into the next international superstar. Some riders certainly seem to expect it. However, so much of owning and riding horses is about the process of elimination. They're all individuals with their own personalities, quirks and evasions. How much of dentistry directly affects the feel, or are there more subtle changes in attitudes or behaviours? Can it affect posture or gait in more severe cases? Disciplines vary enormously within the equestrian world. Horses all have different personalities, abilities and attitudes. Most disciplines require horses to go differently, from racing to dressage, from eventing to polo. However, one thing every rider wants is cooperation. You want your horse to be as relaxed and comfortable as possible, even in a contact, and with hundreds of different evasions ranging from head tilting, one-sidedness, inconsistent in a contact, hanging, head tossing, tension. Quite often it's a case of this process of elimination, trying to figure out how to get the very best out of your horse. And I would see myself as part of the team within that process, along with the physio, osteo, farrier, saddler and of course vet. As we all know, different horses have different pain thresholds. Some horses will show no clinical signs of discomfort whatsoever, even with nasty fractured teeth, even if part of the tooth is causing massive trauma within the mouth. This is the part of my job I find frustrating at times. We know this hurts, we can see the trauma it's causing. Why is this horse just carrying on normally? The theory behind this stoic quality is because horses have evolved over 55 million years as herd prey animals. They don't want to show pain or weakness within their herd, where they get moved to the outside of the herd and become more vulnerable. Others, on the other hand, will use the excuse of a rough edge to send you airborne. So, starting with the incisors, here in the UK, we generally take a view that if the horse has a good bite and with good unrestricted lateral excursion, or the sideways movement of the jaw, that there is no need to reduce the incisors. However, if it is necessary, then generally little and often, due to the living part of the tooth being much closer to the top, is recommended. Moving back to the canines, or tushes as they're sometimes referred to, not to be confused with wolf teeth, which I'll come on to next. These are generally just found in males, but not uncommon in mares, but smaller. Again, a conservative view on reducing the teeth if they're not causing any sores to the tongue is taken. These are old fighting teeth and have long curved roots. They very rarely become problematic to a ridden horse unless they become diseased, fractured or erupt displaced. Most of the time we just round them off a bit if they're particularly sharp. Moving back to the wolf tooth, it's still debated but generally considered by dentists, specialist dental vets and riders to be an interference to bitted horses. It's normally only a small tooth and classed as either normal or blind, simply meaning unerupted, and won't erupt due to the angle that it's at. It has no function, and because of where it sits, directly on top of where the bit goes, it can act a bit like a splinter or cause discomfort from the bit knocking it. These are normally easily extracted under sedation. Some are easier than others, but should always be done by a qualified dentist or a vet that knows teeth, because of its locality to the palatine artery, which runs very close to the tooth. Plus, it minimises the risk of fracturing part of the root, which can sometimes be quite thin. The best time to do this is before a horse is backed and has started its training. Then they're just never there to cause a problem. However, a more considered view on older or established horses is taken. If there aren't any problems and the tooth has remained stable, then we normally just leave them alone. Very occasionally we can get lower wolf teeth, but I've only ever seen a handful in all my time as an equine dental technician. Moving back to the first premolar, there was a term for a procedure called bit seating. It involved a far more aggressive reduction of these teeth than what we do now, simply because it could and would expose the pulp, the viable part within the tooth. So now a more considerate rounding of these teeth is promoted. Whenever a rider takes up a contact, it's easy to see how soft tissue is drawn back. So in order to eliminate any pinching or uneven contact, these teeth are carefully rounded or profiled. Another reason for dental discomfort in young horses can be impacted or retained caps or milk teeth. There are 24 in total. Sometimes they just get stuck and cause food to get trapped and decay, and due to the sharp spikes on the bottom, it's easy to see why they would cause discomfort. As Mark Thorne explained in video 2, every horse will get sharp teeth, and if left, will cause sores and ulceration. It happens quicker in younger horses, possibly the most important time within their education. If we have a quick look where the bit and bridle sit in relation to these teeth, we can see the proximity to where these sharp edges sit, especially with a noseband in place. How those sharp edges relate to a ridden horse is different in every case. Some don't show any signs, whereas others definitely will. However, it's not just about these sharp enamel points. Hooks and ramps will both contribute to pinching when they are small and much more significant soft tissue trauma when left untreated. Also, a carefully balanced mouth helps the jaw in its anterior or posterior range. Here we can see that the lower jaw moves forward when the head is down and moves back slightly when the head is raised. Overly aggressive dentistry does not further improve performance. Slicking out or overly reducing all or too many teeth, where they resemble polished marble, will only ever have a detrimental effect. The molars are there for chewing and should be functional and comfortable. We don't have an infinite length of tooth, and we do have important parts within a tooth that should not be exposed. Accurately addressing overgrowths and excessive ridges will help to prevent diastema or gaps and ensure that all of the row of teeth are working and wearing together at the same rate.
In the yard here, in the business model we've got, nearly all of the 5-star horses have been horses that we've produced from scratch from 3-year-olds, and they'd come to us not having been sat on and not handled that much. So our first thing that we would do is get them ready for backing, and part of that process is them accepting or getting used to having a bit in their mouth. And as you can imagine, if their teeth are sharp or they've got wolf teeth or there's any damage in the mouth, it's going to make it a lot more unpleasant for the horse. And the whole ethos of it is that the horses are happy and comfortable, and they're able to accept the bit and work to the contact. But overall, the horses need to be happy in their work. So the first thing we would do would be to have their teeth checked before we put the bits in their mouth.
That brings us on to nutritional impact. Most quality hard feeds are pretty easy for horses to swallow. Things like nuts are crushed, chewed and swallowed and break down into small particles with relative ease. However, hay, haylage and straw all takes a bit more chewing. Possibly one of the most painful problems within a horse's mouth is deep periodontal pocketing, or gum disease. This is more than likely due to gaps in between molars that trap food. The food then decays and bacteria gets involved. Then in more advanced cases, we get quidding, rolled balls of hay being spat out. The horse still wants to chew and eat, but when the hay gets to the point of pain in the mouth, they simply spit it back out. A thorough oral exam will show us the extent of the problem, and a skilled dentist will balance the mouth to help prevent these gaps from forming. However, not all horses have straight teeth. As with nearly all horse-related problems, when specialist vet treatment is required, the whole cost goes up a lot. However, like any job, dentistry should be done properly and by someone trained and qualified in what they do. There are standards set and exams that can and should be taken. Your horse won't be getting the full benefit if sharp points are left, normally right at the back of the mouth, or by having an improperly balanced mouth, where pressure and wear is poorly distributed. It's not a job that you as an owner can check without the possibility of losing a finger. It becomes an art form for many of us. Good teeth in horses is so much more comfortable for them. They can be efficient at chewing, and in a lot of cases is much cheaper when it's simply routine maintenance. A good equine dental technician will advise you how often to have your horse's teeth looked at so that bad teeth don't become part of the problem. Dentistry in horses shouldn't just be for ridden horses. It should be for every horse, every year, ridden or not. Fat, thin, big or small. They will all develop problems and suffer quietly unless maintained. There is still a lot more research needed, but we would love to know if you've ever had a horse that has improved and how because of dentistry. Please let us know in the comments. Thanks again to both the British Association of Equine Dental Technicians and Spillers Horse Feeds for sponsoring this episode. As always, please like and subscribe to our channel. We've got some really great topics to discuss in the future. Thanks for watching.
So we do use the Spillers Speedy Mash with our event horses. We find it's really great as more of an appetizer for them and to help hydrate them. We did have a case with my son's older pony. He was sort of losing his teeth and had a lot of an older mouth, and we found that feeding the Speedy Mash was a really great way of keeping the condition on him. It's a case of caring for their digestive health as well, isn't it? You want to have enough fibre going through their body to keep their hindgut working, and when they had a difficult mouth, or as in this case the horse was getting older, we found that the Speedy Mash was really palatable and easy to digest.